Hey, how's it going? Leon Chen here. So I haven't done my vlog for a bit, but I actually had a few interesting stories the last few days with low blood pressure, and then some of the patients just needing some care. But I just wanted to talk about what happened today. So uh, we had a patient that had a retroperitoneal bleed. That what that means is retro means behind. Peritoneal. The peritoneum is the hollow area of your abdomen on the inside. So in the peritoneum. So retroperitoneum means the back part of the hollow part of your abdomen. So in the back, kind of towards where the colon, your kidneys are. He had a bleed there. I ordered a CT. But so he has that, and he also gets low blood pressure. Blood pressure is actually important to maintain. You might go to the doctor's office and you're thinking, why do they always measure my blood pressure? Because it is one of the vitals. Vitals do tell us as physicians how you if your life is in any danger. Because blood pressure, there has to be enough pressure in your circulatory system to be able to push blood to your brain, your kidneys, your lungs, to your heart, to your GI system. All your organs need, and so a mean arterial pressure, which there's a top number and a bottom number. We won't get too technical, but mean arterial pressure is basically just an average between the two based on time, and 65 is generally where we want that for the minimum amount to perfuse the blood. And so anyhow, I had told her, and so sorry to go back. So he had episodes of low blood pressure, and he also had a possible bleed in the back of his abdomen or peritoneum. And we had I'm a part of the night team. I take over the night shift while the day people are sleeping, and the day people had put him into the intensive care unit. Intensive care unit was where the level of care is a little bit higher. Generally you have floor. So levels of care would probably be outpatient, inpatient, floor. Then you have step down, and then at the top you would have critical care. So we had him in the critical care unit because we don't have a step down unit because his vitals are compromised, with a possible bleed. So I had, the day team had put him into the ICU, and the nurse had called me saying that we're having difficulty getting access, and she was like, I don't really feel like he necessarily needs labs. He's only in here for constipation, and so the implication when she says something like that is that either somebody told her or she feels like we admitted the patient inappropriately to the ICU, because constipation is not, we talked about level of care. Constipation is outpatient problem. It's not an inpatient. It's not even an inpatient problem. And so she kind of trivialized that, almost like a, microaggression, in terms of saying that he doesn't need to be in the ICU, and you guys incompetently put him here. That's kind of the implication. And I said, well, no, he's not here just due to constipation. He's here due to a retroperitoneal bleed. He's also, his blood pressure is unstable. It might be stable right now, but he gets these episodes to where it drops. So it is important to keep that in mind, just to remind her to maybe not be so callous. We can all be a little bit callous, and so anyhow, it kind of seemed like she kind of brushed me off. She's like, okay, whatever. But I did insist. I said, hey, if you can get somebody to draw those labs, whether it's the phlebotomist, from the laboratory to come draw it, because she said she couldn't draw it, or getting a central line. A central line meaning having more direct access to the vena cava, which is the largest vein that goes directly to your heart, so that we know that the line is more reliable. And so she's like, all right, whatever, you know, no big deal. 2 hours later, then she calls me. I just got a page actually just now, and she's like, Dr. Chen, so the patient, his hemoglobin had dropped from 10 to 6.9, and hemoglobin is a measurement of, when people talk about anemia, it's the component of your blood that carries oxygen, and so you have to have an appropriate amount of hemoglobin to be able to carry, so that your blood can carry oxygen to your to the rest of your body. And so, the normal hemoglobin would probably be around 12ish to 16, depending on if you're male or female. But he was already kind of low at 10, and then he had dropped down to 6.9. At 7, that's when we start to transfuse blood. And the reason I'm kind of making this video is that no matter what kind of profession you're in, sometimes as you work in your profession for a long time, you become callous. And when I say callous, it's kind of like having a callus on your finger, where you use it so much to where there's a barrier, and that barrier almost kind of makes it less sensitive. With an increasing amount of callousness, that might have compromised a patient's safety. And so, not saying that all of us might have these at time. It's just a part of working at your job every day that you start to become desensitized to certain things. But it is something that something that I noticed, that especially in people who work in jobs that can be very stressful, that the more jaded we might get. But to kind of, I guess my point to all this is to recognize that to always take your job very seriously, and always to try to give the benefit of the doubt, even if it's easier for her to say to me that, or think of us as physicians that are inappropriately admitting patients to the ICU, that maybe we did have a legitimate reason, and that she should take it seriously, because had she not drawn those labs, we might not have been notified or informed that his hemoglobin was low, and with that, that could have been a delay in a patient's care. So just something to think about. I just thought about making more of these videos, maybe one per night, on nights that I have a little bit more time, just to kind of give you an idea, almost like a journal, on insight to somebody who's working at the night float, who's a resident in a hospital. So if you like it, let me know. If not, you can let me know too, and I'll stop making them. But and I'll go back to my finance videos. But just thought I'd kind of talk about something and see if try something new and see if anyone likes it. So all right, thanks for watching.